Oh, no, Chair.
Okay, members, I'll make it 6 o'clock. So welcome to the Adults Health and Social Care Scrutiny Board meeting on Tuesday, the 25th of January. It's totally confused me with the days. We normally have it on a Thursday, but this is so we have the opportunities to comment on the budget that's been put forward in front of us. So let's get on with the meeting. So substitutes nominated for this meetings and apologies for absence. So we have Councillor George Robinson as a substitute for Councillor Baines. So welcome, George. Pleased to have you back on this board once again. So your contributions will be most valuable. So thank you for that. There's no other substitutes and no other apologies. Would like to welcome Councillor Dacre to the meeting on the budget item, and of course all the guests that we've got on board tonight. So item number 2 is members' interest for members to declare the relevant interest at the relevant time. Item number 3, admissions to the public. The public are most welcome to watch us on YouTube. Some people do apparently, so welcome on board. I hope you enjoy the debate. So we go into item number 4, which is the minutes of the Adults Health and Social Care Scrutiny Board meeting held on the 16th of December 2021. So can we take those as a true record, please? Thank you, Councillor Hutchinson and Councillor Kingston. Thank you for that. And on that note, I realise it's New Year, so Happy New Year to you all. I hope you've had a nice Christmas break, and I hope you're all enthused for the meetings ahead of us. So item number 5. So we have the Posture and Mobility Wheelchair Service. So welcome. I think we've got a few people here. Rona Bradley, would you like to lead on this?
Hello, thank you, Councillor Blackburrow. For those that don't know me, I'm Rona Radley. I'm the Deputy Director of Service Improvement at Calderdale CCG, and I'm being joined by Andy Holloman from Ross Care, and we also have Judith Clark, who's on observing the call as well, who works in the CCG contracting team. So we've submitted a report to the Council as scrutiny around the Ross Care service for posture and mobility services. We've also got a couple of slides, just 5 or 6 slides, just to give a bit of a recap on that report, and then we can open up to questions. Is that okay?
That's fine. That's perfectly okay. Yeah, good stuff.
Thank you. Sorry, I meant to say I've given wanted to give the apologies of Martin Percy, who's our head of contracting and procurement. Fortunately, he's unable to attend today. He's not in the office for personal reasons. So, but he has been through all this information with us in preparation for tonight.
Fabulous. No worries. Yep.
Okay, next slide, please. Okay, so I've introduced ourselves, so we'll go to the next slide. So a little bit of background into the contract. I just wanted to remind the Council and Scrutiny of where we got to from 2017, really where this started. And it started with Council members working with us as a CCG, looking at the wheelchair services or the posture and mobility services that were in place in Calderdale, and encouraging us to look at a different approach and a different model in Calderdale. And we undertook a piece of work across Calderdale and Kirklees around engagement, which some council members were part of, and helped us to work through that with some service users around a model for wheelchair services. We procured that in 2018, and Ross Care were successful in being awarded that contract from the 1st of April 2019. And unfortunately, 5 months into that contract, we hit a pandemic. And our plan has always been to come to Adult Scrutiny to talk through and introduce you to Ross Care. We did go to the Children and Young People Scrutiny before the pandemic, and we gave some assurance around the whole process, and we shared the papers with Adult Scrutiny, and our plan was to come and have that same conversation with yourselves, but obviously due to the pandemic that didn't happen. So this is our first time here, and this is Rosscare's first time here. So Andy will talk you through some of the introduction about Rosscare and what they've been up to. But we have had some changes since Rosscare started and commenced the contract. And in 2021, so 12 months ago, Rosscare was acquired by Millbrook Healthcare Limited. Hasn't changed the contract, hasn't changed the service. It's just Millbrook are part of that contract now. And that has included an in-house clinical team from the 1st of August 2021. And we wanted to just ensure, to give you that assurance as a scrutiny, that the backlog that we were asked to be cleared as part of the new service and the new implementation of this contract was cleared in the first 12 months and was completed in, it was completed in 16 months due to the COVID, but as opposed to the 12 months which we had agreed initially with Rosscare. But we have been successful in clearing that. I can see that there's a hand up, Councillor Bradbury. Do you want me to finish this, or? Yeah,
if you finish the slides and we'll go through. I've got two people wishing to raise questions. So if you finish the slides, and then we'll leave the questions to the end, if that's okay. Thank you. Anyway.
Thank you. I'll hand over to Andy, who's going to talk you through the introduction of Rosscare and the current position.
Evening all. Thanks for the invite for this evening. Just to update you on Rosscare. We won the contract, as was said, via a competitive tender, and shortly after that we went into the issue of COVID, which still affects us all today. But then during that, our chairman, who was the main shareholder of the business, approaching the age of 80 years old, decided he wanted to retire. So what Michael did was he was looking for somebody to purchase the business, but so that the business would actually continue in the way that it's being run. Michael was in talks with Millbrook Healthcare, and if you don't know anything about Millbrook Healthcare, but they are one of the largest healthcare providers to the NHS in the country. Now, Rosscare is predominantly a northern-based company. All our contracts are north of Birmingham, and Millbrook Healthcare, all their contracts are actually south of Birmingham. So it was actually a really good fit. Millbrook Healthcare, they look after wheelchair services in London, in Devon and Cornwall, etc., etc. So, you know, the fact that Millbrook acquired Rosscare has been a positive impact for us. And what that meant was, although that we were contracting our in-house clinical requirement out to a company called Blatchford, that meant that we could actually bring that in-house. And so we tupied all the staff from Blatchford into Millbrook Healthcare on the 1st of August this year. As Rona has said, when we took on the contract, we inherited a backlog of nearly 1,200 cases. We expected to clear that in the first 12 months, but it took us 16 months due to COVID, and we actually underspent upon the estimate we gave for the budget for that. So next slide, please. Oh, sorry. Yeah. So just to update you, it's me that hasn't turned my slide over. Apologies for that. So Millbrook Healthcare, just to make you aware, now Millbrook has taken over Rosscare as one large company. We turn over £150 million. We have 1,200 employees, 600 vehicles, and we operate in wheelchair services, approved repairer services, and community equipment services. And obviously, we have that increased national coverage. The current position that we have, if you look at Calderdale and Kirklees wheelchair services, As I said, we inherited a backlog of 1,162 cases, and as of September, we ended up down at 468 open episodes of care. We tend to run at about 250 to 300 referrals coming in each month. So as you can see, 468, we are well on top of this service at this moment in time. And the note there states that open episodes of care are reduced by 60% in those 2 years, and in Calderdale alone, reduced by 61% over the period. Next slide, please.
This one's mine, Andy. So
is it? Sorry.
Yeah. So I'll just say that. So the CCG and Ross Care established a contract meeting from the outset of the contract, and that is held on a monthly basis with our contracting team. And they look at the contract management and the service development. So there's an assurance that this is being managed across Calderdale Care Clean. There's a service development improvement plan in place, and some of that information, some of the information on the slide has been provided in the paper that I submitted. So there's some really good stakeholder mapping, engagement, communication, involvement and partnership working happening across both Calderdale and Kirklees, but definitely in Calderdale. Service user communication, information and involvement in place. We've been looking at personal wheelchair budgets, local offer. It's something that was in the specification from the outset, and something that we put in our development improvement plan that we needed to do, and we needed to undertake. And because of the pandemic, that's been paused. We've started that conversation up again in the CCG, and our senior management team have approved for us to start to look at the work that's ongoing in Leeds and other areas, and to mirror a similar process to be able to offer people the choice of a personal wheelchair budget. And then there's some work that we're looking at around bespoke data and performance dashboard, and it's a live dashboard that we'd be able to look at, something that we're keen to start and keen to set up and run, and again has been delayed a little bit with the pandemic, but we're back into those discussions with Ross Care at looking at that. So the service improvements, and a number of service improvements I've already highlighted in the report that you've received, but Andy, I don't know if there's a couple you want to just take people through.
Yeah, sure. I think one of the things that the pandemic has taught us is just looking after each other. And one of the things that we've been pushing our administration team, whether people are calling in for a repair for a wheelchair or re-referring themselves into the service, is to ask that question, are you okay? And we came in contact with quite a few people who were struggling with basic things such as food, just having a chat with somebody, etc. And we've managed to signpost and help people so that they can get some help that they needed, whether that's been mental health issues or just being there to talk to those people. So we have been asking, are you okay, to all our service users throughout the pandemic. The pandemic has taught us that we needed to change. The service remained open throughout the pandemic. Obviously, we had issues with accessing people accessing the service as far as coming in to the building for those who have been isolating and shielding. So we developed virtual assessments, and we had quite a number of success stories. For some people, the virtual assessments didn't work. Some of the elderly people who struggled with the technology, but we tried to guide them through. But we had one instance where a lady couldn't get out, obviously, of a care home. She was end of life. She could not mobilize at all. So we ended up doing the virtual assessment, and we managed to be able to issue her a wheelchair within 3 days, handed that over. We did a virtual clinic. Obviously, the OTs that were in the care home, they could adjust the chair, and we could dial in on a video and tell them, you know, how things needed to be adjusted, etc. And that lady had about 3 weeks left of her life of mobility. So sad outcome in the end, but at least we were there to give that lady those 3 weeks. Also, something that we've started up just in the new year. We've now got a lady on board who's looking at personal wheelchair budgets, and is going to be a lady who looks after and tries to deliver the patient-centred outcomes, which is what the service is all about. Before the people come into the service, they have an idea of what that wheelchair and what that provision will give them in the future, and we want to measure that after a few months and see if it's actually met that provision, met their you know, what they felt that wheelchair would give to them. So there's been a lot of positives, and if we just move on to the next slide, please. We've had some customer feedback, and you know, we've had some fantastic feedback. We've also had complaints. You know, we are human like everybody. We are fallible, things happen, but we take a complaint and we address what that complaint's about. We try to get an outcome, but then we have to learn from that mistake, from that complaint. So we take complaints as a learning experience, but there's some great feedback there. One was really grateful for arranging an evening appointment so her son could go to school, so she could have respite during COVID. And that's something that's allowed us to have appointments out of hours so that parents could still get to work, didn't have to bring their children into clinic, but could still be seen, and we can at least then understand the situation. We've had some great reviews on our through our website, and just one that I just want to share with you about a lady. Her initials are NS, and I had a phone call from this lady, and she was really concerned about her husband, absolutely in tears about what had happened to him and his condition. We got them in, we got a wheelchair prepared and built for them, and I actually happened to be walking through the reception as she and her husband were waiting for an ambulance to take them home, and she stopped me and she said, "Are you Andy?" And I said, "Yes, I am." And she came up to me, threw her arms around me and cried, because she could now at least take her husband around the house and outside. So, you know, we have to remember that this is a service, and it's got people at the heart. We hear of cradle to grave, and this is what this service can be for some people. And I feel it's a privilege to support people like this. And yes, sometimes we might get it wrong, but I think that lady, NS, just the fact of how much it meant to her really hit me. And that's it from me. I think I'll shut up now.
Thanks, and that concludes our presentation. And really, to summarise and conclude, there's the assurance there that we wanted to provide for Scrutiny around the service that's being procured and being provided by Ross Care. There are overall improvements in service performance and quality made by Ross Care, and we've been able to evidence that in the report and both in the presentation. So I hope Scrutiny members can see that, and that's both, as I say, quality and you know, the feedback from staff and from clients. And COVID did come at a point where this service was only implemented for 5 months, so it has been difficult, but the service has been opened and remained opened, and has flexed the way that they've provided a service to people so that they still could receive this service at a time when it was very difficult. So we'll close there and hand back to yourself, Councillor Blackburn.
Thank you, Rona, and thank you, Andy, for coming and sharing those thoughts. It's heading certainly in the right direction from where we certainly were a long way forward. So that's really positive. Just curious as to why the demand has reduced. I guess in some ways. I don't know if someone can answer me that. Has the demand reduced, or is it just that you?
I think it's probably the fact that we've managed to capture everything and get through that backlog, and maybe there's been things kicking about that haven't been resolved, so we managed to get those resolved. For example, before we took on the contract, I had a guy who was struggling with his wheelchair, and before we even had the contract, I had his chair brought into a different depot and repaired, just because of the story of the fact that he hadn't been out of his house for so long. So yeah, I think it's just the fact that we've got hold of it and it's in control.
Okay, good stuff. Right, okay, so we've got Councillor Barnes to start with, please.
Thank you, Chair. I think this was my first scrutiny meeting. This report came to before, and I think it wasn't very complimentary against the previous incumbent. I think I'm being diplomatic there, Howard, if you remember it. So it is very pleasing to see the improvements that Ross have brought into it. There's two questions, one of which relates to Ross and one of which doesn't. Firstly, how are we engaging with local disability groups? Because I think it's important to note that they are stakeholders in this arrangement, and we often use the word stakeholders, but I actually think, to mean one thing, but it actually means much, much more than that. And I think local disability groups, just how we engage in one. The second one, Howard, was in that meeting we expressed some concerns over the budgeting and the allocation of going forward. I think at some point, I think it would be nice to see that in relation to it, because there were some very specific questions we had at that meeting with how the budget had been devised and going forward, particularly at the time with the proposed potential increase in number of users. And I think there was a feeling that the budget was a bit light. So whilst it was pleasing to see the comment about an underspend, I think that was Rona, if I remember rightly, but I think I would like at some point for that to be brought back so we can see how that is performing, if possible. Thank you, Chair.
Yeah, no, that sounds good. Andy, do you want to come back on the comments there?
Yeah, sure, no problem. We started engaging with local disability groups, but obviously then COVID hit, so that just had to wait. I have been in touch with Disability Partnership Calderdale all the way through. Certain individual names, which I won't mention on here, but are quite prominent in the area, I've kept contact with those all the way through. And the fact that we've now got this PWB broker role, part of her role is to start the engagement again. So that will start happening, but I have not lost contact with any of the individuals who I was given to by the CCG, should we say, at the start. As far, is that okay?
Yeah, no, super, yeah.
As far as budgets go, obviously to clear the backlog, we put in an estimate as to how much that would cost, because that's outside our contract. We managed to clear that backlog with an underspend, as was shown earlier. At this moment in time, we are running the service within budget. I have a meeting tomorrow with Judith, and Judith Clark is given those figures. She was given those figures today for how we're doing for this last 9 months. So as far as finances goes, you don't have anything to worry about. We are not overspent, and we are not a company that would go to Judith and hit her with an invoice. If things were getting out of control, we would be talking in advance. And I must say as well, I want to thank Judith as well for her support throughout this time. She has been fantastic as a commissioner, and I really need that to be noted. So I appreciate that. Thank you.
Yeah, certainly noted that, and we, as I say, at some stage in the future, it will be nice to have the opportunity to look at the budgets just for additional assurances. I appreciate the assurances you provide us, but as you can imagine, we are here to scrutinise in a nice possible way. So
we'll do that.
Yeah, no, super, fabulous. Right, I've got Councillor Megan Swift, please. Next.
Thank you, Chair. Just before I start with my questions, could I just say something about scrutiny? It won't take a minute, but there's some fairly new faces around here as far as I'm concerned. And I keep discovering new people that are doing very worthwhile jobs. We don't, at Scrutiny, we are not trying to catch you out. You don't always have to make a waste, but it reads as though it's good. And I'm not tying that in with this one, but I personally, and I'm sure the Chair and everyone else, if there's a difficulty, we'd rather know about it and see if we can help with the process. Right, I'm going to my question now. Thank you for that, Chair. Right, first one, it says something about 18 weeks to treatment. Does that mean it's 18 weeks to the person having a wheelchair? Or just being assessed to?
Sorry, yes, the 18-week RTT, which stands for referral to treatment, is from when the referral hits our service to when the patient gets their equipment. So the 18-week pathway is from referral to treatment.
And just while you've been doing this, and I know, I mean, you came in and it was a bit of a mess, but while you've been doing it, can you think of anything that's gone madly wrong with that 18-week and somebody's suffered because of it?
Yeah. One issue that we're facing at the moment is I'm sure we all get fed up of hearing about Brexit. But it's still affecting us getting parts in from abroad, the container issues, the container costs, the paperwork. Because of Millbrook being the company that it is, we can actually lean on suppliers. We have a vast amount of spare parts, vast amount of stock, so we can actually pull stock and wheelchairs from different depots throughout the country as we need. But that is one big issue that we're facing at the minute, and it's something that we discuss at every contract meeting with Judith.
Yeah, I mean, it's a difficult for everyone, especially anyone who's paying contractors, building contractors. You can actually look at it and see it going up and up. Yeah, sorry. There was one more and I've just lost it. So I'll bring it at this point in time to the reason I'm thinking me is this, it's gone down. Right, so I haven't it in front of me. But you talked about someone down south taking the service back in-house. I wondered what was good about that Calderdale Council wouldn't think about taking it, or CCG taking it back in-house.
Sorry, did I say taking it back in-house?
What one of you did, I'm afraid. Yeah.
Yes. Let me explain. At the Ellen Depot, we have our team, and some of that team, some of the clinical team, were employed by a company called Blatchford. So we contracted that out to Blatchford, and when Millbrook bought Ross Care, we then tupied all the staff from Blatchford to Millbrook so that we had an in-house team. So nobody's moved down south. They're all still within the Ellen building.
And it's not gone back to a council ownership. So yeah, I think that was the point. Yeah.
It's the provider service that has had that impact, not the commissioner. So that's had no impact on the commissioner or our contracts with Ross Care whatsoever. That's a provider change to their service and their organisation.
Yeah. Can I just have one more?
Of course you can.
And I'll go away for the rest of the meeting. I think you need to look at. Yeah, we talked very much about budgets and one thing and another. If somebody does it via a personal budget, is the working out of the cost different if it comes through when you're doing it because you've been requested by social services or someone?
No, if somebody comes to us and we assess them for a wheelchair, which the NHS pays, say, £500 for, then they would get a budget of £500 to then go and buy whatever wheelchair they want. The money doesn't actually go to that service user. We would then pay the retailer. So does that answer your question?
It does. It means that they're not having to pay anything out of their own purse.
If they want to, they have every right to. Yes.
Yeah. But the majority of people won't want, I don't think.
The majority stay with us, yes.
Yeah. Yes. Okay, thank you very much. That's been really helpful.
Thank you.
No problems. Right. Councillor Durans, please.
Thank you, Chair. A few of my questions have been answered, so I'll just reference adding on to Councillor Swift's. In regards to the personal budget, who then takes over the repairs and the upkeep of the wheelchair? Does it become owned by, are they responsible by the person?
If there's three aspects to a personal wheelchair budget. The first is notional, where they stay within the NHS. So, and then the second is notional plus, where they stay within the NHS but have additions to their wheelchair, say a riser to lift the power chair up and down. And then the third is third party, where they go out, completely leave the service and buy their own wheelchair. There is a repair element within every personal wheelchair budget. So for example, say we give them £300 to look after that wheelchair for its life of the PWB, they then can come back to us and we will repair that wheelchair up to that amount. But some people decide to spend the repair element on buying their wheelchair. So they would then be liable to all repairs. But they are made aware of that.
So why would they feel the need to? So what I'm trying to ascertain is what we're costing on need. You know, are we talking about branding because of a want, or are they needing to spend more because of a recognised need? Because I'm not sure if I recognise what you were saying about the electric riser. I would have, my understanding of that would be somebody as a recognised need, that they would need that. So that's why I'm trying to work out where the cost is carried across and how it's costed into their budget, or what's agreed within that budget. I understand that sometimes the NHS don't have a full array of what necessarily somebody might prefer for whatever reason, because all our houses are different. The way that we get about can be very different. So in order for us to access from A to B, all of this is part of the decision that we take. I am a wheelchair user, by the way. Right. So some of my conversation here is kind of going through my process. And I'm kind of trying to work out what element this considered with yourselves, and what's need-based and what's kind of want-based, because sometimes we do just want something because we want it.
Yeah. Well, first of all, we are obviously tied to the criteria set by the CCG. So they have deemed what the service can provide, and that's all within the financial envelope. So for example, on a power chair, as I mentioned, if you feel that you want to go to the pub and be raised up so that you're at the same height as people at the bar, then you can have a riser fitted to your wheelchair. But we don't provide that. That's not part of the criteria. We're happy to be involved in supplying that, but that extra payment would have to come from the patient. And I think as well, just for your benefit, most of the people who go down that third party route where they go and buy their own chair, they know exactly what they want before they come into us. You know, we have Paralympians in the service, and they represented us in 1988 and 92, and they know exactly what they want. So it is very small amount of people that go down that third party route, but we have to give them that option. You know, that's for them to decide.
That's been really helpful, because I thought the razor, to be fair, was to get in and out of the house or the car. So thank you for clarifying that. So
and if you need me, you know where I am.
Yeah, no problem. Thank you.
All
Thanks.
Thank you, Andy, for that. Councillor Hutchinson, please.
Thank you, Chair. I mean, I'm really impressed by how you've got through the backlog of cases, and I fully recognise what you're saying about the efficiencies of actually doing today's work today rather than having to actually manage a backlog. But I wondered, you've said chairs are not provided short term through this service. So I wondered what was the options where the access to a chair makes all the difference between somebody having to stay in hospital or an intermediate care bed and getting home. How are their needs met by this service, or are they met in some other way?
Yeah, if a person has a short-term need, then the service doesn't provide, just as you've said. But if a patient, for example, has been in hospital and had, for example, amputations, you know, we would then issue a chair as an urgent or an emergency. So we tend to have those as a next day delivery. But anybody, for example, if you've broken your leg, that isn't something that we would supply. But we can signpost as to where they can go and either buy a chair. There's the Red Cross, you know, a charity who can fund, you know, who can give chairs out, but it's not part of our service.
Yeah.
And to be fair, it's not just Calderdale, that's national. You know, that's the way it is. I run wheelchair services all over the country, and that is a national thing. Sorry, Rona.
I was just going to say that the short-term use is provided by loan stores or by charities, and that's something that we considered as part of the whole engagement when we talked with service users and with professionals around whether that was something that we changed or not, and it was agreed that that would remain as it is. The thing that we need to do is make sure that people are signposted so that they know where they can get that support and where they can get that help. And Ross Care help with that if people contact them.
And I really hope you can keep the availability of evening appointments going. That sounds a really worthwhile part of the service.
Yeah, excellent. Thank you, Councillor Hutchinson. I know Red Cross do a deposit scheme where you pay a deposit and then you get the deposit back after you finish the short-term use. Andy, I've been most impressed. It's not often I'm not often say this, but actually, the way in which you've answered the questions, very professional. Completely, vastly different to our previous supplier. So I'm most impressed in relation to what you're providing, what you've actually delivered in this period, got the service back up to speed. So you know, big, massive thanks, and I'm sure the wheelchair users out there will be most grateful for your support and professionalism equally. So I think nobody else has any comments to make on that, but as I say, we are your critical friends. So when there are occasions when things aren't going right, we still want to hear from you.
No problem.
You know, but very much appreciate that. And Rona, thank you for bringing this back to the scrutiny. The contributions are most valuable, and the presentation was most useful as well. So so thank you for your support. Andy, I'm sure you've got better things to do, so you're more than welcome to leave the meeting.
Yeah.
Okay.
Yeah. I've got my hand up.
You did. I thought it was from previously.
No, it's been down in the process. It's just one note. I mean, it's not this case because obviously it's been got right. But we put a contract out, or CCG puts a contract out, and partway through that contract, it becomes another company. As I say, like you've explained, but you've explained it in the positive. What happens? Do we follow what is happening with that contract? Or how does it work? And what if we had information that other people didn't have and it was a problem if they did take over?
I'm not quite sure what the question is there. I think it relates to the contract, but there's no changes with the contract, but would have been notified had there been changes? Is that what you're trying to?
No, sorry, Chair. This has been fine, and Andy and Rona have explained what happened. I'm coming from a council perspective for just a couple of minutes, and I want to know if we've given, I don't know, we've given Amanda a contract. Amanda goes and makes a bigger company by having James come along. It doesn't work. Where do we stand when we're paying money and we've got a contract with them?
Right.
It just runs out of us. If there isn't an answer today, will somebody actually have a word with me, and I'll see if I can make it into double dose?
No, I think I understand it. So yeah, if it was detrimental, then I would imagine it would then become legal. But Ian, do you want to come back on that, Ian Baines?
Thank you, Chair. I think I'm more than happy to talk to Councillor Swift outside of the meeting, but where a company is acquired by another company, there's a formal notification in law, in contract law, that has to happen. So if a care company, for example, that we have initially contracted with is bought by another company, there is a formal requirement on the new company to allow us an opportunity to evaluate their ability to deliver to the contract. So there's always a formal process, and we would take out due diligence on that provider and their ability to deliver that service. Where a service provider, so I can think of a couple of cases over the last few years where large care companies, national companies, have gone into liquidation, have reached, but then attempted to sell the people on their list to an incumbent provider, and we've instigated processes by which we would not allow a care company to simply sell their caseload. We believe that those people are Calderdale residents, and we should have a view on who is best to deliver their care. So I think there's kind of two answers really, which is there's a legal process we have to follow, but where we are concerned that we haven't got the right assurances, we will intervene and allocate a new provider.
Thank you. That was the reassurance I was asking for.
Yeah, and thanks for the question, Councillor Swift. It's quite a useful one. So yeah, thank you for that. Excellent. Okay, so I'm going to end this item. We'll go on to item number 6, which is the Calderdale Safeguarding Adult Board. Welcome, Marianne, and welcome, Julia. We've had a few meetings in between, and it's been really nice to have those meetings to keep up to speed in relation to what's happening in your world. We've had the report. Would you like to add anything to this report, Marianne?
Yeah, I was just going to give a little bit of an introduction. I know people will have read the report. Obviously, just to reinforce, this covers the annual year, April 2020 to the end of March 21. So the period when really we were starting to feel the impact of the pandemic. So that was quite significant. And I suppose as a Safeguarding Adults Board, initially the decision was made to pause some of the work of the board, excuse, if you will, the key partners so that they could really focus on the work that they need to do. But instead, we did hold extraordinary meetings to look at what was happening nationally and locally in relation to safeguarding issues, and to look at the data, the impacts of COVID, and really ensure that we were happy that from a Calderdale point of view, we were caring for people properly and taking the appropriate steps. That said, our secretariat functioned, so I suppose our council safeguarding staff continued to do their statutory work that they needed to do. We actually were able to increase our virtual training offer, and we started with a new assurance risk register just to check any changes to services during the pandemic. Obviously, partway through the year, Jed McManus, the previous chair, stood down. So actually on my very first day at the beginning of November, it was a SAB meeting, which was via Microsoft Teams, and we've continued to do our business via Microsoft Teams throughout, right up to our latest meeting, which was yesterday. And really from that point, so from the end of October, beginning of November, it's been business as usual. So we have been able to continue to pick up all our subgroup meetings. We always continued with the SAR activity. So looking at those cases where bad things had happened and examine them to learn the lessons. What else would I like to say? I suppose as a board, we've reflected on the vision, Calderdale's Vision 2024, and we feel that that provides a real aspiration as a place to live and to work and to visit, and really resonated with us as a board and has informed our own vision and strategic objectives for that year and for this year as well. You know, we really want Calderdale to be a place where everyone can realise the potential, where all voices are heard, even those that perhaps haven't been heard in the past, and a place that's really defined by our kindness and our resilience. So that's our aspiration as a board. I suppose as a board, again, whilst balancing the needs to protect those that are living in care homes or perhaps in hospital, and mitigating any isolation that they've had, which has been particularly an issue during the pandemic. We've needed to balance that with those people that perhaps live in the community, and sadly those that perhaps don't have somewhere to live, and those people living street-based lives. So a lot of work around that. We developed a self-neglect toolkit, and we set up a multi-agency hoarding panel really to look particularly at those areas. Obviously, a big piece of work for us as a board over the last 12 months has been the Burnt Bridges thematic review. That's really challenged our thinking as a board to think about how we can better protect those people in our community. As I've already mentioned. The review itself, and we've reported to Scrutiny about the review, and we're back to present again on the progress next month. Has had it's engendered a real culture shift in Calderdale. I think we've all thought differently about people living street-based lives, and we've provided a much better umbrella of support for those people. I'm not going to particularly talk about that. I'm happy to answer any questions, because obviously we have reported and are reporting specifically about that. But I think we recognise as a board that whilst we've had a significant part in that board, that's part of the bigger piece of system learning. So we're working closely with other board strategic groups, particularly Health and Wellbeing Board, around that agenda. Throughout the pandemic, SAB have maintained a really sharp focus on the physical safeguarding of the most vulnerable, as you would expect us to do. I'm happy to report that due to sort of really swift and decisive implementation of protective measures in Calderdale, we have seen fewer deaths in care homes than we would have expected. Although, as I say in the report, any death is one too many as far as we're concerned. I would commend the tremendous work that took place to develop additional accommodation, both in a hotel, but also developing services at the gathering place to safeguard people, the most vulnerable, through the peak of the pandemic. I think probably just very proud of the work undertaken by all of the safeguarding professionals in Calderdale during perhaps the most challenging period that anybody's faced. And I think the way that professionals have put the need to care for other people above their own personal safety and that of the families is to be applauded. And we're not out of the woods yet, I would say. It's been a particularly difficult time for people in the health and care sectors. I talk about in the report looking forward to our peer review. Of course, we've had our peer review now, and we'll no doubt be reporting on that in the future. And I suppose that's it really as your chair. Very proud of the work that the board have undertaken. It has been a tricky 12 months that we're reporting on, and that's continued, but I think there's been some fantastic work to try and mitigate the risks presented by the pandemic, and actually to go further and improve the way that we care for those people that need our care and support. Happy to answer any questions, and I know Julia and Ian and Sean are all on the call, so we can perhaps collectively answer any particular questions that people may have.
Thank you, Marianne. Thank you for a very comprehensive intro on that. It's really really helpful and reassuring. Certainly, as I mentioned earlier, we built up some really excellent communication over the period, and it's really good to work with you rather than working against you. We're not working against you. You already know that, so we're happy for that to continue. Councillor Kingston, you have a question.
Thank you very much, Chair. I've actually got several questions.
That's okay.
I'll ask them consecutively. Just read, they're all prompted by the report, all my questions. On page 31, that's in the agenda items, the papers as they've been provided to us. You say that the board has created networks to build stronger links with the community. And I just wondered if I could have some examples of that. So, you know, it was a statement that I wanted to interrogate. What networks have you built?
Do you want to ask one question, then get the response, and then somebody's not been overloaded? Then Julia, do you want to come in on that?
Yeah, sure. I haven't got the same page numbering as you, but I should know this. So our engagement officer Sophie's built a network of contacts of care homes, so care home staff, and then for service users within the care homes. So domiciliary care are included in that network, community organisations, voluntary sector organisations, and it's actually shared across children and adults. So that there are a number of different organisations on that network. Interestingly, they've never come together face to face. It's always been a remote, either asking them questions via survey or their opinions on certain things, or asking them at the beginning, as we did in COVID, what were they most concerned about, or, you know, anything to escalate to the board. It's kind of two-way communication. And interestingly, through our peer review, it was suggested that we get that network together. So plans are afoot to do that further.
Excellent. Okay. Would you like to continue with your extra questions?
Yes, please. Thank you very much. Right, and then it was about the website. You said that you uploaded safeguarding videos and leaflets to the website in response to COVID-related concerns. And this all relates to the public messaging. I was just wondering, how is the website itself advertised? How do you ensure that people are actually visiting the website? What advertising do you use? I did wonder whether you employ or consult with advertising professionals to ensure that you're getting the largest reach that you can with this messaging.
It's a low uptake of the public accessing the website. So how we use it usually, and I think that's the same up and down the country, and certainly is the same for our Children's Partnership website as well, which is shared. How we use it is we encourage our organisations that sit on the board, so our partner organisations, who in turn have contact with service users, to use it. So it's a bit of a, in order that everybody can access it, that's where it is on the website. So if you want to look at the video around scamming and show it to your service users, we encourage our organisations that sit around the partnership to share those leaflets, print them out, or show them whilst you can on devices. Yeah.
Okay.
But again, they all go through the network usually too, with regards to sense checks, things like that.
So I think I've misunderstood the purpose then, because I was thinking about, I think I read something somewhere about public messaging for the public in general, not just the service users and the staff that were working with them.
I mean, anybody can access that, can access the website, councillor. If you were to go onto the Calderdale Safeguarding Adults Board website, you would see, which anybody can, you would see the links to the documents. And in fact, I do some lecturing at Huddersfield University, and before I even got there to talk about safeguarding, previously they've recommended to a lot of the students on the courses there our website, because of some of the excellent resources that are there. aimed a lot of them at professionals, but equally would be helpful for members of the public. We do have a communication and engagement subgroup that sits below the board, on the board, as part of the board arrangements. And certainly one of the areas that we are working on is linking more with frontline staff, but also with members of the public, and trying to get some more of those messages out. So they are there to be found. We haven't spent a lot of money on promoting the materials by using an advertising agency or such. But by things like our Safeguarding Week, where we're promoting those messages and providing training, which is accessible to everybody. But as Julia says, the main focus is to get it out to our partner agencies and to practitioners working on the front line, so that they can provide that advice and guidance to members of the public.
I think just to add to that, the bit about Safeguarding Week is crucial, because that's where we do try to target the public as well with safeguarding messages. And we got 2,500 views that week, and Facebook and Twitter impressions were really high of how many had engaged with those posts that we posted every day during Safeguarding Week. So we need to do more, but yeah, Safeguarding Week is our big push for the public messaging.
Excellent. Do you have some more questions? Yeah.
Right, just a couple more questions. One was about the home that had 18 nursing care beds in a self-contained section, it says. I just wondered, how did you ensure that the rest of that home was kept safe from the people that were moved into that part? Was there absolutely no mixing of the staff between those two areas of the care home?
With regards to COVID, yeah, I think Ian could come in with that rather than it being safeguarding. Yeah, Ian?
So we commissioned the dedicated resource as part of our prevention COVID strategy. It needed to be staffed independently and not share staff across homes. And it also needed to have clear independent entrance and exit points. So it limited the contact with the broader care home population. We did that in advance of government establishing something called designated beds, which was a requirement from the local authorities. So we were able to extend that contract to be a designated bed, and on top of our own locally based infection prevention control support we did to that home, it also had an enhanced IPC infection control inspection from CQC.
Thank you very much. Just two more things. There's a comment just to say well done, that we're one of the few LAs to have not evicted any clients and ensure everyone on the streets has been offered accommodation. I was really pleased to read that. That was fantastic. And then a question. There was quite a lot made about the number of referrals for self-neglect based on training that it was coming across, that you believe this is as a result of training. And I wondered, how do you know that that's a result of training about this area rather than an actual increase in self-neglect?
Yeah, so the issue of self-neglect has risen over previous years that we've reported on in previous annual reports about the low numbers of referrals of self-neglect, very, very minimal. So we have done a lot of work with regards to the self-neglect toolkit, with regards to training sessions, briefings, spoken to staff wherever we can in team meetings, in really pushing it. I think 100% can we say that we'd like to claim some of that, you know, where if you can't claim that actually all of that work is just a coincidence, that it's resulted in lot higher numbers of self-neglect. But the awareness that Burnt Bridges, the report itself, has produced around self-neglect, it is pretty, I think we can assume that a lot of the awareness raising that's gone on just from that report alone has resulted in the number of referrals being made.
Excellent.
I've just found one more thing I questioned. there was a mention of something called challenge events, and I've no idea what those are. So I'd appreciate a bit of explanation.
Yep. So we undertake independent reviews, as Marianne's just alluded to. They're quite costly. There's a lot of people sat around the table at quite a high level, providing a lot of information, and they take a long time. Therefore, they cost a lot of money. They're imperative to us to get the learning, and actually, they provide the real what is going on at frontline or at manager level. So they're extremely crucial to us to be able to learn from in-depth reviews into single cases or thematic reviews. We want to know whether all of that work that we've put into it and whether the learning that we've got from it has made any difference whatsoever. So the challenge events are literally testing out whether the all of the work that goes on around reviews and the dissemination of learning, has that been embedded, has it changed any practice, has it had any positive impact on individuals, on communities, has it had a positive impact on practitioners' lives, made their lives easier? So they can include interviews with practitioners, interviews with managers, interviews with service users and communities to test it, because data can only tell us so much. We want to know actually what's been changed as a result of those reviews. So that's what they are, and we do them with every single review, and usually come up with a little bit more learning as well once we've done that challenge event.
Excellent. Thank you, Councillor Kingston, for your questions there. Really helpful. Councillor Barnes.
Thank you, Chair. I've got two questions. The first in three parts. The second is a nice simple one, I hope. First of all, the report. Thank you very much for the report. Detailed, a good report. If I was to ask, and I don't know whether this is who's going to answer this one, what is the one thing you are proud of in that year? What is the one thing you could have done better? And what as we as councillors could do to support you in that going forward? And the second part, and I suppose this is a little bit negative, is that we are in January reading a report from 10 months ago, for a year that finished 10 months ago. So it's very difficult to scrutinise a report when 10 months has happened and a lot could have happened since. Is there any way that the report could be brought to us at an earlier stage, even if it's in a draft format, for us to have a look at? That might not be possible, and I do appreciate the nature of the board and who it reports to and what have you, but it's very difficult to scrutinise a report from 10 months down the track. Thank you, Chair.
Who would like to answer that? Marianne, would you like to have an
I'll start. Anybody chip in? And obviously it's difficult for me because I've only been here half of that year, but I think if there's one thing that we're really proud of, I think it is the impact of the Burnt Bridges report. Really tragic set of circumstances, but the response to that from individuals through to organisations has been tremendous, and to the public as well. So I think that's probably the thing that we're probably the most proud of. What could we have done better? That's a difficult one. Let me think about, and I suppose that probably leads on to how you could support us. Well, perhaps the thing we could have done better for Councillor Barnes perhaps was to bring this report a bit earlier. I know that sort of agendas for various meetings are set well in advance, but I'm sure that's something we could table this report a little bit early. We'll have to adjust our timescales, but I'm sure that's something that we could do, and Julia and I will pick that up definitely. What could we have done better? I think probably one of the things that we could have probably done better was to communicate at an earlier stage the necessary changes to access to care homes. Perhaps that's an area that people asked lots of questions about, people were really worried about, and appeared a lot in the media. I think we made some really good decisions at a very early stage, and perhaps in Calderdale went earlier with some of those protective measures. perhaps at the time people thought we were perhaps jumping the gun, being a bit heavy-handed, but the impact on the level of deaths, I think, has reinforced that the right decisions were made. Perhaps we could have communicated those better, maybe. And how could you all support us? I think the way that you can support us as a board is really the work that you do in your own localities. So I think if you start to see things happening in your areas, in your constituencies, and you've got those concerns, is to start raising those with us, so that we can have those discussions before it becomes, you know, if you pick up a trend or you've got a query, concern about something not right, working right, then raise that with us, and that would really help us, whether it's an individual case or whether it's a theme that's emerging where you feel there's a gap in service. That would be really helpful, and certainly I think some of the work around homelessness has demonstrated that very much over the last year. I don't know whether Ian or Sean or Julia wants to come in and add to any of my answers.
Julia, yeah.
Yeah, I think I'm proud of the fact that we not only managed to cover all of the statutory functions in the period, but actually we improved more. So the learning from burnt bridges, as Marion said, but lots more as well. So which leads me on to what we could do better. I'm not sure, because our ask is of organisations who have already got a day job, and basically they're providing the information, the commitment of time to us on top of their day jobs usually. And so to do things better or quicker, you're expecting people to do more and more and more. So I'm not sure about that question. We could always do better, but that has impacts on other people and their capacity and what we can physically do. I think we just need to clarify as well that the Safeguarding Adult Board is an independent board. Marianne is an independent chair, which goes through that scrutiny process, and the content of the annual report is then worked on in our wider development days with the wider partnerships, is discussed at other boards as well. So it's not that we're waiting for it to be presented to scrutiny to do any of that kind of work or to kind of have that independence. So it's just to point out, but yeah, we can try and improve these timescales, Councillor Barnes. Yeah.
Excellent. Thank you, Julian. Thank you, Marianne. Councillor Durans.
Thank you, Chair. In regards to the, sorry, I can't remember what it was called now because I keep thinking of No Second Night Out, but the Everybody In report, that's everybody's been offered accommodation and continue to offer, which I think is fantastic. And I guess the thread throughout around the self-neglect and the burnt bridges and learning from that, I just wonder how much of, if do we know percentage who has remained within accommodation and what other support was offered around them to maintain those tenancies, and I guess engage with health services and things like that, just to kind of reduce the repeating patterns that they may be used to falling back into.
I think we can provide a whole wealth of information about that, Danielle, and actually we are able to come, I think it's the 10th of February, I want to say, to talk about burnt bridges, where all of that should be, but I've made a note to make sure that is included in our progress update report, Danielle, and then we can bring you stats and more.
Sorry if I've jumped.
It's fine. No, it's good.
You.
Excellent. Councillor Fenton Glynn, do you want to come back on that element, or is it a different matter?
No, I was actually going to say very much what Julia just said. Actually, we've got quite a lot of work on burnt bridges, but rather than get too down in the weeds on that, I think it probably does need a proper scrutiny session where we can look at everything that's been done on it.
Indeed, yeah, no, thank you for that. Councillor Kingston again, sorry, yeah.
Thank you. Just a comment to say thank you as well for including in the report about the impact of austerity and continuing austerity, and the impact of poverty on safeguarding. I really appreciated that. I think it's important that we remain aware of that, just considering that we're about to look at our budget, so which of course is affected by that. Thank you.
Okay, thank you, Councillor Kingston. Marianne, you're a great asset to have on board as a chair. I think it's brilliant. It's been really good to be working with you. You bring an awful lot to the table, and you do an awful lot of work in the backgrounds that we only know half of what you actually do, I think. So a big thank you for coming back to Scrutiny, because it's always a bit of a challenge. I think I had a bit of a tough time last time we came to Scrutiny, in terms of the reports. We are your critical friend. We keep saying that, and we are. The door's always open and always welcome to have you on board, and keep continuing with the regular meetings to keep us all updated, to keep going on. So thank you for bringing the report to us. And I'm sure we all take a great deal away from that. So thank you indeed. You are most welcome to stay for the rest of the meeting, because I'm sure you have other things to do. So, but thank you very much, and thank you, Julie, of course.
Thank you. Cheers.
Thank you, Howard, and it's a privilege to do this job in Calderdale. So thank you very much.
Good, thank you. Okay, so we now come on to the Cabinet draft budget proposals. The show is yours, Councillor Fenton Glynn. I think we'll start. And just before you do, I'd like to welcome Councillor Tim Swift, leader of the council, and I'd like to welcome Councillor Baker. I'm just seeing her on screen. Oh, yes, there you are. I'm sorry, my apologies. When you're looking around the screen, you're sort of trying to find people. Very much appreciate you joining the meeting to go through the proposals that you put forward, and clearly challenging time. So over to you, Councillor Fenton Glynn, first of all.
Yeah, obviously it's been a really challenging budget process, this one. Obviously you've seen the papers, but I'll just kind of canter through and give a bit of background to the papers, and where the decision has been taken. I think obviously the starting point for all this is that we want to be in a world where we're delivering few of these savings, but to do anything and just to kind of keep at a standstill with the service that we're offering, we're having to look for savings where we can find them. And the easy choices aren't there anymore, because that's the economic climate that councils find themselves in, and that social care in particular finds itself in. So that's the kind of background, and it's kind of thank you for the opportunity to speak about this, but there's no easy answers. So what I would say though is that what we've done is we've tried to do it in the most sympathetic way, in the most supportive way, and I think you'll probably see that throughout. So kind of going through, we've got the reimagining of day services, so that's kind of the support for people, and kind of day services people to take. It'll be essentially, at the moment we have on 3 sites. We're going to reduce that to 2 sites, but within that we're going to actually do what we can to have centres of excellence, so have some really good services that people can use, so they offer a lot more. So that's kind of that's that one. And I think with a lot of these, there are trade-offs and there are savings, but actually in the long run it's going to hopefully kind of also continue to lead to us improving the service. Then, sorry, I've just realised I'm looking at the wrong paper. But sorry. Yeah, then kind of moving through, we've got the, hang on a minute, let me just bring up the charge for self-funders. That's something that we have an option of doing. So the way that one works is essentially some people go through the council and but they self-fund their care packages. At the moment, we administer that for free. We've got the option of charging for it. And while again, it's not something you necessarily want to do, it's something we have the option to do. And people may choose not to do it for us, but they may choose to do it with us, and then we'd charge. So either way, we'd either be spending less on it, or we would be making a saving there. Further integration of some of the quality work. What we're looking there at doing is making sure we're not duplicating work. So there's a lot of work going on with other partners where they also kind of look at kind of quality work, and we're just making sure that we're not duplicating it. So obviously no savings in the first year of that, because actually we're implementing a new system. We want to make sure that we get that right. Decommissioning of Hope Street. This is essentially we had kind of administrative functions there, which over the pandemic have been delivered in a different way anyway. So that's one which we can do relatively kind of quickly and easily, and you know, again without too much of a knock-on impact. Assistive technology. This is again where you can kind of save labour by having kind of good use of technology and using as many of the kind of assisted technologies that are out there that you can. And that, you know, it's one of those things where it's a bit of a win-win, because it means you have fewer people coming in, kind of traipsing through people's homes and stuff in some cases, and it's just making the absolute best use of that technology that is already there to make sure that people get the best service that they can. Sorry. And then the reprofiling of the roles increasing the use of shared lives is that's essentially kind of specific social workers who kind of have the shared life specialties. Them doing the work that they do helps keep people out of kind of different residential settings and helps them from needing more support. And it's just about making sure that we're training for those interventions so that we can use. So if you can hear a crying child in the background, so we can make less use of those kind of more expensive interventions and hopefully give people more independence.
Thank you.
That's the thing, but I think I might have skipped over one. But yeah.
Yeah, thank you, Councillor Fenton. Can I just raise a general, not concern, but whether this is going to have a not negative impact, but put more onus on the carer with some of these cuts. I suppose there seems to be I can't think of the right words. Something going through some of the savings. Totally, accept the savings, but it's purely what impact will this have on some of the carers, I guess, is one of the questions. The other one, very quickly before bringing Councillor Barnes in, is in relation to the re-imaging of day services. If we can work with the councillors that are involved in those areas, I think that will be most helpful, because the first thing we tend to find is that we get the question, you're closing our day centre, why are you doing that? So perhaps those are the two key things. But said the carers element was something that's like the assistive technology. Does that put more onus on the carer? I guess in some ways.
Well, I'd say in terms of the reimagining of day services, we currently have 3 sites. We have considerably more than 3 wards in Calderdale, so it's not like it's a site per community. It's essentially, with all these things, there's a lot of transport that takes people to the sites where these services are delivered, and within the kind of looking through this, we're making sure that the transport continues to be available to help people that need that support. In terms of the carers stuff, I might look to Sean or Ian to answer, just because they probably have a better idea operationally, but my understanding is actually it's more about making the most of the visits that people have and giving people the best support when they are visited.
Yeah, excellent. Yeah, perfect. Thank you. Ian, would you want to come back on that element, please?
Thank you. And certainly one of the things that we recognise is the importance of carers and family carers. And what we've not seen in these proposals is any reduction in support to carers. So I think you quite rightly, Chair, highlight the issue of assistive technology, but that's not to remove care, it's to actually use assistive technology in the journey as early as possible to help people remain independent, and allows people, for example, for carers, to have some formal breaks by knowing that the technology is there and that we could, for example, monitor someone if they were to reach a particular crisis point. So I do appreciate that there might be some concerns. I hope we, as the budget consultation works its way through and we're able to engage with people about what those are, we'll be able to describe what this technology offer is. It's not about replacing care, it's about bringing this technology in to help people lead the lives that they would like, and it would only ever be through consultation, and people would need to feel comfortable with that. And I know Scrutiny will have heard me talk a lot about dementia over time, and I think one of the things that we know that works really well with people who are newly diagnosed with dementia is to introduce wearable technology. So where family members feel that they worry about a relative, a loved one going wandering and feeling that they can't take respite because they're always kind of worried that they're going to lose their loved one, then actually bringing the technology in will offer reassurance and work with families rather than place an additional burden on families. I hope that helps.
Yeah, no, it does actually. Sean, do you want to come back as well on that? Just on mute, I'm afraid. Sorry.
Thank you, Chair. Just to add to Ian's point as well, if members, as far as the Centres of Excellence was concerned, we wanted to make sure that carers were at the centre, and they will be involved as part of the consultation as the service users, staff, and the community more generally will be involved to make sure that the new Centres of Excellence, wherever they will be, will have carers at the core of that as well. So, we're looking at surgeries in terms of and support networks where they can either attend in those bases or as part of the hubs that come out from each of the Centres of Excellence. So that they feel more involved, but importantly, they feel part of a network with their own, within their own group and wider groups as well, and that they can access things in the community that they didn't before, including employment, essentially.
Thank you for that, Sean. Councillor Dacre, do you want to come back on that one?
Yeah, just to say that something, for instance, like the shared lives one, the way I'd see that, and Ian and Sean will tell me if I'm wrong, is that it's there again to try to support people in their own setting, but to ensure that they can stay there and that it doesn't all become so difficult both for them and their families and friends that they have to go into some sort of supported accommodation. So it's a really positive move, I would say, for those who are carers. And I think the same goes for the review of early help, that I think we would hope that if that works, it's going to ensure that things don't reach crisis point again, just in the same way that we've done with children, where you try to avoid things escalating. And that, again, has got to be better, both for the individual and for those caring for them.
Yeah,
so no, sorry, I was just going to say, whilst these are, in a way, it's as times have changed, those options of something like the assistive technology have become available, which wouldn't have been available at one point. So it's credit to those working in the social care that they've been able to not just throw up their hands in horror when they've been faced with finding costs, but look at good, innovative ways of doing things that could actually make things better.
Yeah, no, appreciate that, Councillor Dacre, because it is, from our point of view, being on a scrutiny board for adults, it's about the carers as well, and that assurance is, I can see the advantage of some of the modern technology. It's just questions that we need to. I want to satisfy myself. Ian, do you want to come back on that? You've got your hand up on that.
Thank you, Chair. Councillor Dacre makes a really important point, is that in terms of what Cabinet are bringing forward in their budget consultation, is attempts to try and limit the negative impact on any savings. And actually, shared lives, whilst we think it will deliver a saving, what it will mean is we actually expand the shared lives offer so that people who may be on a path to needing additional support can actually do that with a personalised carer who can work through and probably help sustain that person in their current situation for longer. So it kind of defers the need, for example, to somebody to move into formal residential care. So these are attempts to try and redesign and make more efficient. But each budget round, and that actually some of those things are always going to be difficult ones to make and will create challenges, but we are trying to be creative in the way that we want to see people's independence and outcomes still to thrive, even though we are trying to make efficiency savings.
Brilliant, thank you, Ian, for that. Councillor Barnes.
Thank you, Chair. I've got 3 comments, questions, clarification point needed. Firstly, on the implementing charging for self-funders, these are genuine savings, because if we are no longer charging, is that actually saving us money? Because you mentioned the risk is that self-funders will start to arrange their own care. So are we saying that 14,000 is what it's costing us at the moment to run that facility, and yes, by charging it out? So in effect, it is genuine savings. And if half the people who are using our free service at the moment use the council, then actually we'll make a bit of money out of it. Correct? Is that right? Good. Yeah. Okay, that's fine. Thank you for that. Second point is there's a couple of items where there's obviously work going to be done next year or next financial year to get us in a position to make the savings in 23, 24 and onwards. And there are some big savings on some of those. Could I ask, and if the committee are happy with this, that there is somebody comes back in 5 or 6 months' time to see on those particular items, subject to them being passed at council, of course, that they could come back and actually review where they are against those set objectives. So if you look at the reimagine of day services, there's nothing this year, but 100,000 the year after. Would it be possible that either Councillor Fenton-Glynn, if he's not on paternity leave, or whomever comes back in 6 months' time and says where they are on tracking of that? Is that okay?
That's not unreasonable. So,
and the final point, the biggest saving or the biggest element of savings this year is the review of early help at 180,000. But I'm noticing at the answer in question 5, there's no list of major risks associated with that. Is that actually correct? That there is no major risk associated with achieving £180,000 saving in the next 12 months on that one?
Yeah, I mean, so sorry, that was one that I actually didn't cover when I was going through the list. But I mean, the key thing that's doing is that there's a lot of people in the social work team doing roles which aren't social work. So it's about deploying our skills where they're best used. So it's making sure that the people who can make some of those decisions are able to make those decisions. So that's why we don't believe that there to be a risk. I mean, I'm happy for Sean and Ian to jump in as well if they've got anything to add.
Thank you. Ian, would you like to come back in?
So the principle behind this particular saving, which Councillor Fenton-Glynn's kind of alluded to, is about saying that currently in that part of the social care offer, we have a lot of our experienced qualified social workers. And actually what we are getting feedback on is that actually what people want is people who can help them navigate living in their community, and they want to be connected to their communities. So what the saving is shifting the skills base in that team away from the qualified social workers into more hybrid roles around care coordination or care navigators. What we also know is that we have struggled to fully recruit in other areas of adult social care to our social work posts. So we are running a number of vacancies. So what we'll be able to do is redeploy our qualified social workers into existing vacancies, therefore staying within our budget envelope for salaries, but it will also mean that we have an ability to have a different skills mix in prevention and early help, which, if this works well, and there's always a risk with this, is that we may not realise the savings at the pace that we hope, because there will be an element of recruitment, induction, and getting the team up and running. But I remain confident that if full council delivers this saving and this ask for us, is that we will find ways of delivering it. And we know that in this year we've had some really tough savings targets to address, and I'm happy to report to Scrutiny that we have achieved our in-year savings. So we will remain committed to doing it. That no saving is without its challenges. So Councillor Barnes is right, is there will always be risk, but we are confident that we can deliver that. There may be some slippage, but we will also work hard to make sure that we'll identify other ways to make sure that we're on target.
Thank you, Ian. Sean, do you want to come back on that as well, please?
Yeah, just to add very quickly, Chair, that to mitigate the risk as well, what we've been doing and will continue to be doing as part of the demand management work that we've undertaken is to look at the complexity that's coming through the door that essentially the community social work practice team is working with. And where there is high level of complexity, there will still be the need for the system to make sure that there is a qualified social worker to deal with that. But what we also know is that there are other levels of less complexity that can be dealt with just as well by unqualified staff. So we're undertaking that piece of work to evidence that and mitigate the risk. So that, we're not going into uncharted territory there.
Thank you, Sean, for that.
Chair, thanks. That does give me the reassurance I was looking for. So thank you for that, gentlemen.
Excellent. Thank you, Councillor Hutchinson. Councillor Hutchinson, sorry.
Thank you, Chair. We're all very well aware of the problems of recruitment and retention of care staff. So I would like to know a little bit more about the implications of this budget on the levels of pay that care staff will have. I believe it says that payments will increase in line with the national living wage this year, but will be brought forward from the 1st of April as a bonus. But what assurance do we have from partner agencies that these uplifts will be passed on in full to the carers who work for them?
So if I can start, and then I'm sure that Ian will have something to say on this, but I mean, if we were to offer a kind of pay uplift of any form, it would be done through a contract variation, and the understanding of a contract variation is that that money is passed on, and they simply wouldn't get the money if otherwise. In terms of this budget, it's not specifically addressing that particular part of our relationship with our contractors. It may be something that we're kind of looking to through other means in terms of ensuring that it's competitive. And I think everyone knows where I stand. I do think it's important that we are competitive with it, because at the moment, our competition isn't care in other places. It's other low-paid employers, because unfortunately we have an economy in care which doesn't value care work, which is bizarre, because I think everyone around this table will agree that care work is more skilled than a lot of the other low paid work that kind of people could equivalently walk into. And I think that's ultimately comes down to a government decision. That's why I was particularly worried to read this week that they're looking at not even giving the care uplift that has been proposed in some of the Sunday papers that was suggested. So, I think that's a key kind of care funding question that I do think we need to look at in the long term. But in terms of this budget, it doesn't come in directly, but it's obviously something that we're looking at on an ongoing basis, how we can properly value our care staff. But every time we do have a contract variation, that is part of the contract, and we just won't give that extra funding. We don't give them extra funding and say do as you will. We say do these specific things, and obviously it'd be something we'd look at in future if people weren't prepared to implement variations that paid their staff well, if that was what we wanted to do.
Thank you. And Chair, on a different tack, I know it's not in the adult services and wellbeing section of the budget, it comes under the Chief Executive's office, but public health funding. The budget's going to be flatline essentially over the next 3 years, and it's not much different from last year. But we know that inflation is very high, national insurance is going up significantly. So what differences will we see in the public health service as a result of this essential, it's flat, it's essentially reducing budget?
Debs, do you want to come back on that, please? Yeah.
Yeah, thank you. Thanks, Councillor Hutchinson. Yeah, I mean, we're doing some work to look at how we can integrate public health services, both with each other and with other parts of the system, so that we get the best possible value for the resources that we've got. So for example, we're doing some work at the moment to look at, there's a range of support that we get that supports adults' health and well-being, by helping people to change the behaviour, to have a healthy behaviour, to adopt healthy behaviour, to sustain that behaviour by being supported in the local community, and then being connected to assets in the community that can enable people to be healthy. And we've got a range of services and opportunities run separately at the moment. So, for example, one of the things that we're looking at is to integrate those much more closely together. So there's a programme of work that we're just developing at the moment. As you know, we've been full on dealing with the COVID response, as you know, Councillor Hutchinson. But we've got a programme of work over the next sort of 18 months that looks at that, for example. And there are some other services as well, for example, public health services for children, where we believe that if we join them up and integrate them with each other, but other parts of the healthcare and wellbeing system, we can get the best possible value for the resources that we've got. So we've done some work as a public health team looking at what's the recovery of the public health function from COVID? What will the function look like? Learning from what we've learned from responding to COVID, and how do we really capitalise on what we've learned from the way that we've worked. And there's a few things. I think really engaging communities has come out really strongly, joining up much better, and taking an outcomes focus to the work we do, rather than making a service the starting point or an input the starting point, making the outcome the starting point. So we'll look forward, Councillor Hutchinson, to bring some of those plans as they're developed through to this committee when the time is right, if that's okay.
But will it produce further changes in health visiting and school nursing, for example?
I think I don't know the answer to that at this point, but I think what we're looking to do is think beyond just thinking about health visiting school nursing, for example. If we think about best start in life and early years and new and expectant families, there's lots of services, aren't there, and opportunities in Calderdale to deliver really good outcomes. And it's about really integrating those services up. So thinking about our children's centre, thinking about what our voluntary and community sector does, what our health visitors do, and the same with school age. We've in our health and wellbeing strategy, we've identified 4 priorities, and there's priority outcomes. One for developing well for school age children is around good emotional health and wellbeing. And again, it's about how we integrate the things that we're doing. At the moment, we've got some separation between different services, so it may lead to changes. But what we would hope it will do is lead to better outcomes and better use of resources by the whole system working to deliver outcomes in a more integrated way.
Okay, fingers crossed. Thanks a lot.
Thank you, Councillor Tim Swift, and welcome to the meeting.
Thank you, Chair. I mean, actually, since I indicated, Deb's covered a lot largely covered the point I was going to make, which was a good example. But just to expand, you know, we're talking over the next 12 months about retendering the children's centres contract, for example, and you know, the real opportunity to make sure that that joins up the key public health services more effectively than we have done before, and that's being built into the early work on this now. The second thing to bear in mind is that thanks to the previous stewardship of the budget, I mean, as in addition to the funding position, and at least this year we do have flat funding going forward rather than further reductions we've seen in the past. There is also a useful public health reserve, which enables a bit of flexibility in the planning as well, which, as we're still going to have ongoing costs from COVID for a while, is quite important too. If I could just make a couple of wider points, and perhaps Councillor Dacre might want to add to these. I think it's particularly important to emphasise with the adult health budget that of course, because of the way we do this, we often focus very much on the growth and savings. But the budget that we present this year, compared to the budget that we agreed last year, has already been through a number of changes. So the MTFS and the standstill budget have both built in, actually in the case of adult health, quite significant changes. So if you look through the budget document at the gross expenditure line, you'll see that gross spending on adult health goes from £102 million to 109 million over the 3 years, and that 102 is an increase on the year before. So there's some very substantial increases, largely driven, I have to say, by inflation, allowing for an above inflation increase in the costs of care, quite rightly, and also demographic change. But if you compare adult health with the other directorates, you'll see that this is the only directorate where you've got this kind of substantial growth, because that reflects obviously the importance of these services, but also the huge pressures that they're undergoing forward. I suppose the other point to make and bear in mind is that we're presenting a 3-year budget here, and I think the value of that came out in the conversation between Josh and Mike earlier about those items where there's little saving in year 1, but by flagging them up now, we make sure the work's done to deliver the savings in year 2 and year 3. But of course, we don't have a 3-year settlement, so there is an element of risk about that because the income for the next 2 years. But we still think that's the right thing to do in planning terms. Thank you, Chair.
Thank you, Councillor Dacre. Do you want to add anything to that? I think it's quite comprehensive, but you're more than welcome to.
Yeah, thank you, Chair. Just one point really, which is that obviously it's clear from our budget that we've raised council tax and that we've raised the social. We have chosen in our proposals to raise the adult social care precept of 1%, and I think the point's been well rehearsed about the way in which social care is funded and the difficulties that causes for local authorities, especially the ones who don't have houses of high value like ours. But what I just wanted to say to people is that it's relevant in a particular way to this scrutiny panel and the people who are affected by it, because of course many of the people will be those, the adults that we're talking about will be those on lower income, and there's inflation and council tax rises coming on top of that. We appreciate are going to be difficult. So I just wanted to highlight really that we've done what we can to try to protect those who are least able, in that the council tax reduction scheme will still be there for people. Those who have to, in some circumstances where adaptations are made to homes for the disabled, then there can be a reduction in the council tax. And of course, for those older people in receipt of pension credits, they don't pay council tax at all, and there is council tax reduction scheme available for the elderly and adult disabled who are on lower income up to a certain amount anyway. So it's very difficult choices there, but we've tried to do what we can, and we've also, for everybody, really strengthened our relationship with the CAB and just internally our processes to try and make sure that if people do get into difficulties over that, that
it's looked at sympathetically at a very early stage, and everything is done to try and ensure people don't really end up in huge difficulties and going to court over it. Thanks.
Thank you for that, and thank you for coming to the meeting and presenting the budget. It is a challenging, it's challenging times. It is a challenging budget. You've created us more challenging. You've filled our workload for the next 12 months with some of the things that need to come back. So very, thank you for that as well, Councillor Kingston. Then I'll bring Mike Lodge in.
Excuse me, it's a question prompted by what Councillor Dacre's just said, actually. I remember reading in I think it was in the safeguarding report or one of the reports that we've looked at this evening, that the Calderdale demographic is changing and that it's expected that we're going to have a greater percentage of older age people in years to come. And I wonder to what extent that changing demographic has been considered as part of the budget, what's the word for it, discussion, planning, that's the word, as part of the budget planning.
So what I would say is that's not a Calderdale specific thing. Our population is getting older. You may have been introduced at some point to what was referred to as the Barnett graph of doom, which essentially looked at the cost of statutory services versus the cost of income for councils, and particularly with adult health and social care, that has been, that has been a ongoing concern for a lot of people in local government finances. Ultimately, at the moment, there are a couple of things that we are doing. So we're looking at the age-friendly community. Part of that is in recognition of the importance of an ageing population. Actually, the more you can get people to live well and active and make this brief about not just providing services but providing kind of active lives, the better. And kind of we do it because it's the right thing to do, but also if we can keep people out of those services, that's another good thing. But ultimately, we can only, in terms of this budgeting, I think there are other challenges for us in terms of long-term commissioning, and that's something that we should definitely be looking at in the coming weeks and months in terms of what services we anticipate. But the only thing that we can do in terms of this budget is kind of keep going with the likely envelope we'll have in the immediate term. But we do need to someone to step up with a long-term funding solution, and that is why it's a concern that even though we've heard about this the social care national insurance charge coming up, that's now being relayed on. So even that, which I think was actually insufficient, even that may not continue. So we need something, and actually we need longer term support. As Sylvia said, we've got a 3-year budget at the moment, but that's based on continued support. But actually, I mean, there's people around here who run businesses. You will know that it's hard to run a business if you don't know what if your income could drastically change. And that's a position that local councils are in, because local government has been deprioritised, not just by this government, but by previous governments. And I think, something that we all have to push for is that local government, and particularly social care spending, is guaranteed, is supported, and is fundamentally kind of put on the right footing, because our population is getting older and we need to be ready for that, and we need to be able to plan on that basis.
Thank you, Councillor Fenton-Glynn. I think it is we're facing challenges and an awful lot of changes as well over the next 12 months, which we certainly recognise as a board. Mike, would you like to come in, Mike Lodge?
Thank you, Chair. Just to remind members of the process that we go through. So Sophie Fazana and myself have been scribbling throughout this discussion, and a report will go to Strategy and Performance tomorrow evening. That has your comments and those of Children's and Place Scrutiny Boards, and they will prepare a report to put through to Cabinet when the Cabinet considers all the consultation on the budget on February the 10th or something close to that. Thank you, Chair.
Okay, thank you, Mike, for that, and so thank you for coming and presenting the budget, and most importantly, thank you, officers, for coming up with some very challenging savings to make, and some hopefully we'll work with you, we'll challenge you along the way, and quite a number of items that I say will end up on the work programme that we're keen to explore and make sure that that we can help fulfil the savings put forward. So thank you, Councillor Dakin, thank you, Councillor Tim Swift. You're more than welcome to stay, but I'm sure you have various other duties to continue with. So I'll thank you once again. So good evening if you are leaving. So we'll go on to item number 8, which is a COVID-19 update. Right, who would like to lead on this? Debs, I think you look like you want to say a few words.
Yeah, I won't take lots of time up today, Councillor Blackburn. And it may be that Ian wants to just come in with a little bit more information about the care sector particularly. But just in terms of where we are at the moment, you'll be aware that sort of over Christmas the testing regime changed. So I think just after Christmas, the 5th and the 11th of January. So people that have taken a lateral positive, people with a positive lateral flow test don't need to get a confirmatory PCR anymore. And ultimately what that means is we can't rely on the data quite as much as we could previously, because we know not everybody registers the lateral flow test. I would encourage anybody who takes a lateral flow test to register them, because it really helps us understand what's going on. It also helps us make sure we get enough lateral flow tests into Calderdale as well, because that's how we get supplied by how many have been used. So but despite that, despite us the data not being as accurate as previously, it does appear that we've had our peak from Omicron, or from this wave of the Omicron variant of COVID. So in the most recent data we had, which is the 13th to the 19th of January, we had 2,242 Calderdales tested positive for COVID-19, and that gives us a rate of 1,060 per 100,000, a little bit higher than England and a little bit lower than the region, and it's reducing. The case rate's reduced quite steadily, really, through from probably about the 10th. Sorry, not the 10th. Sorry, probably the 1st, 2nd, something like that of January. It's been reducing since then. We're sort of mid-table in our case rates of the upper tier council, so we're 53rd, so a little bit higher than average, but not much. And it looks like, as I said, that the number of cases peaked in the first few days of January, and it looks like hospitalisation, so the people in hospital with COVID, looks like that peaked around a week later, around the sort of 9th, 10th of January. And there's been a rapid reduction in cases since that early January. That reduction has started to slow now, and we've got a lot of outbreaks in schools following the start of term. And we've actually got 184 outbreaks in 76 sites. 64 of those reported to us in the last 7 days. So these are unprecedented numbers of outbreaks, more than 4 times actually, just looking at the number, the highest we've ever seen previously. And we believe that's that Delta was being spread in schools before Christmas, and then we had the Christmas mix in, children who'd previously been exposed to Delta, exposed to Omicron, gone back into school, and Omicron spreading in schools. And actually case rates are reducing in all age groups at the moment, except primary school age children, where they are still increasing. We've got 40 outbreaks as of before lunchtime. We had 40 outbreaks in care settings. I think we might have slightly fewer now. 3 of those are in the last 7 days. So we've got a slowing of the new outbreaks in care settings, which I think is good news. the outbreaks and the high case rate is affecting staffing right across sectors. So not just in the public sector actually, but it's also impacting on the commercial and businesses as well, with so many people with COVID and being off work for that reason. We know that when we've had previous waves in Calderdale, when the case rates come down, they settle at a higher level than average. And obviously we don't know what's going to happen this time, because there's limited restrictions, or no restrictions going to be in place after Thursday. So in terms of what all of this means, I think Ian will have heard me say this morning at a meeting, living with COVID doesn't mean ignoring it. We do need to live with it, but we absolutely shouldn't be ignoring it. And as we emerge from Plan B and the restrictions relax, there is a number of small things that we can all do to help keep Calderdale going while cases are so high. So that is wearing a mask, even though it's not mandated, it's still considerate to others to wear masks, keeping your distance and limiting mixing with people you don't live with. So we're not saying don't mix with others, but think carefully and about doing that, and recognise that it is mixing with other people that enables the virus to spread. And if people are mixing indoors with others, the people they don't live with, plenty of fresh air, let plenty of fresh air in. And then really encourage people to take a lateral flow test before leaving home if they're meeting others indoors, particularly when visiting elderly or vulnerable people. And finally, we know that getting the vaccine or boosters are a big decision for some people. It really, really works. The vaccine, and particularly the booster, really works in protecting against serious illness from COVID, and particularly the Omicron variant. So what we'd say is it's really not too late to get your first, second or booster dose. It's not too late to change your mind if you've previously decided not to have the vaccine. And that's my update, Councillor Blackburrow. But Ian might want to say a little bit more about care.
Thank you, Debs. That's always extremely useful. And can you pass on our thanks to the school settings, because I think they've had some very extremely challenging times managing that, and it's quite stressful, I'm sure. Ian, would you like to add a little to that?
I think Debs has probably covered a lot of what I was going to say. We have gone through a period where we've seen more outbreaks in care settings than at any point in the pandemic. Fortunately, I think what we've seen is low numbers of residents testing positive. And I think that is testament to the high level of vaccinations in care settings. So what Omicron has done is it's becoming incredibly transmissible, but actually we're not seeing the same acuities that we saw in some of the other waves and other outbreaks. We did step up at what we call our tactical command response in order that we could support our care settings to manage those well. So we'd managed to step that down up until Omicron decided to rear its little head. So we've had daily tactical command across the partnerships to make sure that we are on top of what's happening in those care settings, giving them the most support, making sure that when we can bring those out of outbreak as quickly as possible to ensure that people can kind of go on with their daily lives. One of the things I think that we have seen across the system is the challenge in the workforce. So we know that the workforce has been stretched because of Omicron absences. We are starting to see staff returning to work, which is really positive. We will see some challenges coming forward with the vaccination programme, because whilst we had a really good uptake in our care home workforce, as part of the new mandatory vaccinations for health and social care, it's brought into sharp focus that the regulations will include home care. Again, we're working from a really strong base. So 86% of our home care workforce across Calderdale have had their first jab, and 82% have had their second jab. But because of the mandatory timeline, that they will need to be double jabbed by the 1st of April. So we've got a very small window to make sure that those staff who have yet to either have first or second jab, which amounts to about 700 people across the home care workforce, get that jab.
Thank you, Ian, for that. Councillor Hutchinson.
Thank you, Chair. I was wondering, with 40 outbreaks in care homes currently, what impact that was having on the ability to discharge otherwise fit patients from hospital into care home settings, whether they were still able to be taken to go back to care homes which were in had a current outbreak.
So the where a person is a normal resident in a care setting, we have been able to continue discharging people to their rightful place of residence in accordance with the outbreak and isolation periods. So people will have returned to care settings but had to be nursed in isolation in accordance with the guidance. Where there have been some challenges, and I think Scrutiny will appreciate this, is where care homes themselves have had really low staffing ratios. They have on occasion been reluctant in order to take people because they can't deliver safe care. They will always prioritise existing residents to get back home as quickly as possible because it is their home. In terms of people requiring a period of residential care after a hospital stay, that has been challenging. And as a system, we're trying to work through how we can help that flow through the system. But there have been some challenges, and they will continue, I think, for the next few weeks. But hopefully, as all parts of the system are moving through, we'll start to see some of that flow out of hospital start to work more effectively again.
Have we had to look at opening beds in hotels this time round?
As a kind of precautionary measure, we have looked at engaging Cedar Court again if we needed to. We haven't yet had to step that up, but we're keeping that under constant review. We have looked to other care providers to make sure that we're maximising where we can all those placements in registered care settings.
Thanks.
Thank you, Councillor Hutchinson, and thank you, Ian and Debs, for that update. It's extremely useful for us to communicate in the community we work in. So thank you for that. So it brings us on to item number 9, which is the work programme. It has been distributed. There will be things to add to the work programme. I will allow Mike to speak in a few moments, very briefly, so we can all enjoy the rest of the evening. So Mike, over to you, please.
Just one thing, Chair. I had a conversation with Sean earlier on today, and the item you've got scheduled for next month on prevention and early help would be better timed in a little bit later in order to get some things through. It also relates to the proposal in the budget on the community social work team. So with your permission, we'll put that back to either April or possibly June.
Excellent. Yeah, no, that's fine. That's perfect. Brilliant. Okay, so that concludes the business. I very much appreciate your contributions. We've done quite well considering the amount of items we've had on the agenda. So not bad. So thank you for attending. Thank you, officers, for your contributions equally, and enjoy